Beto, first of all, thank you. In New York, we remember what it looked like in March and April, and seeing some of the scenes down in Texas, it looks eerily and even hauntingly familiar. Obviously there's daylight between the White House and Dr. Fauci and others. Just how bad have things gotten in El Paso and the surrounding areas?
It's really bad throughout Texas. Houston, which hosts the largest medical center in the world, has run out of ICU beds at the Texas Medical Center. You have Corpus Christi, you have Galveston, you have my hometown of El Paso, where my sister Charlotte is an ER nurse, all getting hit hard. But no place, Richard, is as bad as the Rio Grande Valley. I was just talking to County Judge Richard Cortez of Hidalgo County, which has McAllen and Edinburgh, Texas. They're having to store the dead bodies in refrigerated trucks because the morgues and the funeral homes no longer have space. The doctors and nurses are so tired, and some of them are getting so sick that they don't have enough medical personnel to take care of everyone. And they also don't have bed space. So, Richard, ambulances are waiting up to 10 hours after they've picked up a COVID patient who's in distress at their home, 10 hours at the hospital waiting for a bed to open up to take that patient in. It's no wonder that you've seen a spike in deaths there, as you have in Texas. So we just passed 4,000 deaths in Texas. It took us 53 days to get to the first 1,000 deaths. It took us just 10 days to see the last 1,000 deaths. And it shows no signs of slowing down until we implement a stay-at-home order, which our governor is refusing to do.
Your governor came around, albeit very late, to the ideas of masks. And I'm sure, you got a family there, you go around and not everybody's compliant with the order. Do you think it's because of leadership? Do they not know the risks attached to this point, or do they know and they just don't care? Where should the fault lie as to here we are in the middle of July, and we're so far beyond so many other parts of the world that went through the first wave?
It is all attributable to leadership or lack thereof. As you know, Texas was one of the last states to issue stay-at-home orders in April, one of the first states to open up on May 1st. And not only did we opened up everything, including bars and restaurants and movie theaters. And you can attribute that opening prematurely on May 1st with the spike in cases and hospitalizations, and unfortunately, Richard, in deaths that you've seen thereafter. And yes, Greg Abbott belatedly came around to a statewide mask order, but that is simply insufficient to face the crisis at hand. We need a stay-at-home order. And then get this, he will not even allow local county judges, like the one that I described in Hidalgo County, from issuing their own stay-at-home order. So not only will he not lead, he won't get out of the way so that others can lead. And the consequence is the deaths of our fellow Texans, more than 4,000, totally preventable had he followed the science and done the right thing, and totally predictable when he failed to do both.
I want to remind our audience what the Lieutenant Governor of your state, Dan Patrick, had to say. This was early on, but he hasn't backtracked from these comments.
There are more important things than living, and that's saving this country for my children and my grandchildren, and saving this country for all of us. And I don't want to die. Nobody wants to die. But man, we got to take some risk and get back in the game and get this country back up and running.
Congressman, you got 3 school-age kids, and every school district in this country is struggling. Everybody knows in-person learning is better, but obviously with the risks attached to the kids to a degree, but more certainly them as carriers, how to open, how to do so. I'm curious your perspective, and you're very involved in the community. If the school doesn't give the right decision or they want to reopen too soon, where will your line be deciding as to when to go back and how, or in the case of the kids, when to send them back and how?
It's interesting, and I'm glad that you played that quote from our Lieutenant Governor, who through a quirk of our state constitution is most likely the most powerful elected figure in the state of Texas, superseding even the governor. And for him to openly say there are more important things than living begs the question, who is it that he wants to do the dying? In a state much like the rest of the country, where African Americans and Latinos are disproportionately getting sick, being hospitalized, and dying, in a state where the minimum wage is $7.25 an hour. So those frontline workers who have no other economic choice but to go back to work and risk their lives in doing so on the front lines. And then your question about education, specifically public education, nearly half of school teachers and public school educators in Texas work a second or a third job because their first most important job does not pay enough to make ends meet in their homes. So we're going to be sending these teachers and librarians and cafeteria workers and school bus drivers into harm's way. Many of them will have no choice but to go to work or to lose their job. They're the ones, even more than our kids. And you're right, I've got a child entering the 8th grade, another in the 7th, and another in the 4th grade. We will choose to keep our children at home until there is a strategy and a plan to protect their teachers, the support staff, and other educators at those schools. They're the ones that I worry about the most, as I do for those kids who are returning to a home where they may live with their grandparents who are in their 70s or 80s or 90s, who are the most vulnerable and most likely to be hospitalized and to die if they contract COVID, as you mentioned, unwittingly carried by their grandkids back into the home. So we need to stop community transmission with, in addition to the mask order, a stay-at-home order. We need to have a very vigorous testing and contact tracing and isolation program. And then when you have low community transmission, low positivity rate, low hospitalization, you carefully reopen schools, test vigorously, contact trace, make sure that everyone is safe before you continue any further.
A little bit later in the hour, I'm going to speak, Congressman, to a former colleague of yours up on the Hill. Where does the relief package stand right now? But I've seen lines in your state to get tests. People camping out overnight. I've seen lines miles long for people just to get food. Can you articulate for our public, and you know, we're in about a dozen states right now that they're watching us, if the relief ends on July 31st, people losing their homes, their apartments, people no longer getting the unemployment check, food stamps, just how draconian the pain will be felt by so many people. And if you can put it in granular terms for people living in your district here, just give an idea just how bad this could get if Congress doesn't get their act together.
To put it in perspective, in the first 2 months of this pandemic, twice as many Texans filed for unemployment as did in all of the year 2019. That has produced lines at our food banks, including at the El Paso Food Bank, where my wife Amy and I volunteer, that stretch 2 or 3 miles long. Folks will get into that line at 2 or 3 a.m. in the morning in the hopes that they will be able to get a place to get a box of food that will last them throughout the week, because they don't have an income, they don't have a job, they're unable to make ends meet, and now they risk foreclosure or being kicked out of their apartment and being on the streets. People desperately need food aid, and more than just food banks, we need to expand the Supplemental Nutrition and Assistance Program, or SNAP, so that folks can have the dignity of shopping for themselves in a grocery store and buying what they and their families need to be able to get by. We need extended unemployment assistance. We need extended financial help, direct cash help to families who are really struggling right now. This, the wealthiest, the most powerful country on the face of the planet, certainly has the resources to help those who are struggling at a time unlike any other in our lifetimes. You'd have to go back to the Great Depression and the pandemic of 1918 before that to find similar levels of crisis and struggling. So, Richard, people in Texas are hurting, but I want to make sure that we don't lose focus on those who are hurting the worst. In the Rio Grande Valley, where they've run out of hospital beds, nurses and doctors are running low on PPE and oxygen. They're storing dead bodies in refrigerated trucks. This is a crisis of monumental proportions, and I don't want your viewers to lose sight of the fact the Rio Grande Valley is 90% Mexican American. So when we talk about the systemic racism and injustice in this country, it is not just an historical anecdote. It is playing out right before our eyes right now in Texas. People need to stand up and demand more from our elected leaders.